With the state's largest school district set to return to class on Monday, Democrat lawmakers are demanding Governor Kevin Stitt call a special session to repeal Senate Bill 658, which prohibits school districts from implementing a mask policy without meeting certain criteria. The governor doesn't believe a special session or mask mandate is warranted. And as Rory Taylor reports, there are strong and vocal opinions on both sides of the issue.
What we're hearing from doctors and teachers is that the most effective way to prevent us from a return to virtual learning is to have universal masking in our schools.
House Representative Emily Virgin is the House Minority Leader and echoes calls from doctors to repeal Senate Bill 658. House Representative Kevin West is the House author of the bill.
It prevents school districts from implementing a mask mandate, K through 12, unless we are under a state of emergency. That state of emergency could be statewide or it could be more localized.
Doctors in the state have been participating in that conversation, cautioning that while new COVID strains will affect children more than earlier ones, COVID is also joined by another respiratory virus.
The ICUs are filled with a somewhat out-of-season RSV outbreak in these younger kids that are occupying a lot of the ICU beds. We do have younger kids with COVID in ICU beds, but it's not the predominant case or diagnosis that's filling those beds right now.
Emphasizing that COVID becomes most dangerous when it can't be treated.
COVID is a layer on top of everything else. So anywhere we had capacity issues before are going to be exacerbated by the current situation.
At the time of Senate Bill 658's passing and signing into law, Oklahoma's COVID count was low and on its way down, with lots of optimism brought on by vaccines. But as cases rise again, some parents still want remote or hybrid options for their kids. Joy Hoffmeister is the state superintendent and a member of the OETA board.
We know that there are families that still are seeking a hybrid model or a fully remote virtual option. For the most part, we are seeing our families embrace the recommendation of the pediatricians across the country and in Oklahoma, which is children need to mask up, of course, but then be back in person for classroom learning. That is so important.
Riverside Indian School in Anadarko has already made the decision to begin the year fully virtually due to COVID safety concerns. On Monday, Tulsa Public Schools released a set of safety guidelines stating that all students and teachers are expected, but not mandated, to wear masks at all times, regardless of the new state law. Teachers, doctors, and lawmakers all have concerns about the law's flexibility.
There's absolutely nothing in this bill would prevent parents from sending their children to school wearing a mask. And the governor has talked about this a little bit this week. We're just saying that as a state, we're not going to mandate that you have to wear a mask.
So what we're seeing around the country in schools and out of schools is that when you have large segments of the population that are unvaccinated and that when they're together and unmasked, that outbreaks inevitably are happening because the Delta variant is so contagious. And so it looks like that's what we're headed towards in Oklahoma if we don't change this law and make sure that our locally elected school boards can make the decisions that are best for their school districts.
I do think that there's a lot of flexibility within this. Like I said, the governor could declare an emergency down to a very micro area if need be, or the entire state.
We feel that it's really irresponsible to keep this law in place, and we want to give that local control back to the people who were elected for these school districts and are closest to the situation.
But one thing both agree on, everyone wants to keep kids in school, including doctors.
So the American Academy of Pediatrics put out a really nice article about kids returning back to school and what they recommend. And so they recommend that they do want kids back in school to be around others for the social, mental, and everything like that. And so because the vaccine's only approved to 12 years old and above, they recommend universal masking in school. Keeping kids healthy will be essential to keeping schools open, a necessary task as the Department of Education readies to catch up the last year's lost learning.
On Thursday, Superintendent Hoffmeister announced a $13 million program to provide at no cost Science of Reading academies to 10,000 Oklahoma teachers, in addition to other professional development programs to help ensure newly increased staffing is ready to go.
Well, we know our districts are hiring new support folks to help provide the kinds of services that our kids need, whether that be a reading specialist, even more school counselors to make sure our kids are on track to graduate.
Parents can also expect to see vaccines available at their school.
What we have this year that we did not have last year is the vaccine. And this is an incredibly effective mitigation strategy in really suppressing community spread of COVID.
Rory Taylor, The Oklahoma News Report.